Have you ever looked at a whole handful of pills and just thought, do I really still need all of these? If you have, you're definitely not alone. Today, we're talking about a really powerful idea called deprescribing. It's this concept that sometimes the absolute best thing a doctor can do is take a medication away. So let's dive in. Okay, so think about how it happens. It's kind of like this medication creep. You get one prescription, then another one for something else, and pretty soon you've got a whole collection going. Now, each one probably made sense at the time, right? But when you step back and look at the whole picture, it can get, well, really complicated really fast. Not to mention just the stress of managing it all. And this is where your pharmacist gets a really cool new job title. See, they're not just there to dispense pills anymore. Now they're detectives. Their mission to look at your entire medication list like a crime scene, searching for clues. They're trying to figure out if each medicine is still the hero in your story or if it's maybe become the villain. So, all this detective work, it actually has a name. And it's the heart of what we're talking about today, deprescribing. But what does that word actually mean? Right, so let's be super clear. Deprescribing is not about just taking your care away. Not at all. It's a planned, careful process that you're a huge part of. You and your healthcare provider basically sit down and weigh the evidence for each medication, asking that one crucial question. Is this still helping more than it might be hurting? The focus is always on what's best for you, right here, right now. And the goal here isn't just about having a smaller pill box. The real payoff is a better quality of life. We're talking about thinking more clearly, feeling more stable on your feet, and seriously lowering your risk of having a bad reaction between two different drugs. It is the ultimate example of less is more in medicine. Now, a big decision like this, well, it's not something anyone makes on their own. It is absolutely a team effort. And let's just go ahead and talk about the elephant in the room, shall we? Because when a doctor suggests stopping a medicine you've been on for a while, it can feel scary. You might start to think, wait a minute, are they trying to deny me the care I need? And that is a totally valid concern. But the answer to that question is a huge, resounding no. And here's why. It all comes down to two key words: consent and monitoring. You are in the driver's seat here. Nothing changes without your full understanding and agreement. And then, after a change is made, your team watches you closely to make sure it was absolutely the right call for your health. So, how does this actually work in the real world? Well, it's definitely not just guesswork. There's a very clear 4-step safety plan that makes sure the whole process is done carefully and correctly. Think of it as that methodical investigation we talked about. Step 1, identify. The team looks for any medications that might be good candidates to stop. Step 2, prioritize. You don't do it all at once. You figure out which drug to tackle first. Step 3 is the plan. You map out exactly how to reduce or stop it safely. And finally, the most important part, monitor. You follow up, you track what happens, and you make sure the outcome is a good one. It's systematic, and it's all about you. Let me give you a super common real-world example. Heartburn medications, specifically something called a PPI, or proton pump inhibitor. So many people get put on these for a short-term problem, but then, whoops, they're still taking them years later. Our pharmacist detective would spot that, talk with the patient about the risks of long-term use, and, only if the patient agrees, create a plan to slowly taper off while keeping a really close eye on things. Now, deprescribing isn't just for your everyday health checkups. It actually plays an even more profound, more critical role when the entire goal of care changes, especially when we talk about palliative care. In this setting, the whole philosophy of medicine shifts. The focus is no longer about preventing something way down the road or adding more years to life. Instead, it's all about adding life, quality of life, to the years that are left. It's about comfort. It's about dignity. So those preventative medicines, things like statins for cholesterol, they often take a back seat. They're designed for the long game, and that's just not the focus anymore. Instead, the medications for comfort, for pain, for nausea, they become the absolute stars of the show. By deprescribing the just-in-case meds, you can really focus on the right-now meds that make a difference today. Okay, so as we start to wrap this up, let's circle back to that big idea from the beginning. What does truly great medical care actually look like? And this, right here, is the thought I really want to leave you with. Every single pill in your cabinet has a story of why it was started, but our life stories change, don't they?
And as they do, our prescriptions should too. Sometimes the most thoughtful, the most personalized, and frankly, the bravest form of care isn't a new prescription at all. It's the careful decision to stop one. So maybe the question to ask yourself is, have you taken a look at your medication story lately?